What's up, everyone? My name's Elliot from Pragmatic Rehab Principles, and today we're going to be talking about the shoulder. Today we're going to be watching a video together, and I want to remind everyone, let's take a skeptical look at this gentleman's views. Let's not attack him personally.
Stop doing this exercise right here, the cable upright row, and here's why. So anytime we have excessive internal shoulder rotation while loading the muscle like this, that can wreak havoc on your joints, connective tissue, and definitely cause some shoulder impingements.
Okay, so number one, this gentleman claims that doing the upright row can definitely put you at risk for shoulder impingement syndrome. Now, to be perfectly honest, there is some data that suggests doing upright rows does in fact put you at more risk for developing shoulder impingement syndrome. However, we have to look at how researchers actually describe shoulder impingement syndrome and what their criteria was to make that diagnosis. As a brief overview, shoulder impingement syndrome is thought to happen when the topmost portion of the scapula, called the acromion, pushes against or squashes the top portion of the rotator cuff. That top muscle is called the supraspinatus. As I mentioned earlier, we have to be skeptical and understand how the researchers were defining shoulder impingement syndrome. In all of the studies, researchers defined shoulder impingement syndrome by having a positive Hawkins-Kennedy test, which is an orthopedic test that is thought to stress the supraspinatus and test for shoulder impingement syndrome. To make things even more complicated, research like this questions the practical and clinical uses of the Hawkins-Kennedy test, saying that it doesn't actually test for supraspinatus or rotator cuff impingement syndrome. In fact, this precise paper reads in the discussion section, however, in our study, Hawkins-Kennedy impingement test did not compress supraspinatus within the subacromial space, and this is consistent with another recent study replicating this test using cadaver specimens. Also, if impingement syndrome was due to the acromion crushing the supraspinatus, then wouldn't surgery work? According to this paper, surgery doesn't work for shoulder impingement syndrome. In summary, is the upright row definitely going to cause impingement syndrome? Probably not. It's hard to say.